for the first visit with me for a teenage girl, she can expect mostly talking. We don't tend to do a pelvic exam at that first visit for most of my teenage girls, actually. I usually, in the course of that visit, if mom has come with her to her appointment, I usually will invite mom to step to the waiting area and I can discuss things with just the teenage girl. Or it's certainly also up to her if she says, no, I'm more comfortable if my mom stays, then we have mom stay in the room with us for the whole discussion and exam. So things that we would routinely discuss at a health maintenance visit or a wellness visit in a teenage 16, 17, 18-year-old girl are going to be certainly her periods. What do her periods look like as far as pattern? How often are they coming? How heavy are they? How painful are they? But also, certainly, we would want to talk about what things that we could do to make periods better if they're a problem for her. It's also routine that I talk about things like sexually transmitted infections, how we prevent those if that's something that is an issue for her. I also make a point to talk about healthy relationships and what that looks like in the teenage years and as she grows, because I think the data is clear that the more informed a teenager is about her body, about what's normal, and about what a healthy relationship looks like, the better choices that she makes about her relationships. Another reason that I would see a teenage girl is if she hasn't had her first period at all by the age of 16. That is a kind of age cutoff where we would say this should prompt us to do a little bit of investigating to see if there's a reason why. And sometimes there's not a reason, it's just later than average for her. But sometimes we do find a reason, a cause that can be managed or requires treatment in some way. So if you're reaching a point where you're beginning to wonder, is the pediatrician still the right place for me, or am I ready to move on to more of a women's health specialist or adult medicine? Might be about the time that you start thinking about making that first appointment to come see a gynecologist. Because like I said, even though we don't do a pelvic exam initially, it's nice to have a year or 2 or 3 where you've been to the same place, you know the people, you see a familiar face, so that at 21, when that first pelvic exam that maybe is a little anxiety-provoking comes due, you're more comfortable just being in an environment that you've already been in before.